Hey guys, so there are three things that I try to get across when I'm teaching, and three things that I tend to try to emphasize when I'm treating in clinical practice. I quite like it because it sort of simplifies the process. So number one, I want your treatment to be ethical. I want you to be an ethical practitioner. The treatment is about the patient, not about the practitioner. It's patient-centered, not self-centered. You're not trying to sign them up to some platinum treatment plan of 15 sessions a week for the next 25 years. You're not trying to sell them some form of false narrative about repositioning spinal structures and popping hips back in and creating sort of the idea of weak joints and weak structures, the idea of reliance on the therapist. I want you to be an ethical practitioner. Number two, I want you to be a clinical practitioner. What you are doing is clinically relevant. You're not one of those therapists that just cracks someone from head to foot, regardless of the presentation. You are using a modality, you are using a treatment to elicit a specific effect, and you are then going to back that up with some form of exercise, rehab, education, lifestyle advice, whatever other things that you're going to do. So the emphasis is from a clinical perspective, I have an understanding of what it is I'm doing, why I'm doing it, what I'm looking to get out of it, and then how I am going to back it up with some form of biopsychosocial, education, nutrition, lifestyle, exercise, rehab, tissue resilience, okay? And then finally, number three, gentle. I want the technique, no matter what you do, whether it's mobilization, manipulation, needling, soft tissue, I want it to be gentle. I want it to have an element of finesse over force. The idea that as a practitioner, you're not having to smash the joint into submission. The idea that you're working with the patient. You're not brutalizing the patient to try to elicit some of these temporary neurophysiological changes in symptoms and in function. The treatment should be gentle, okay? It's about working with the patient. Remember, these techniques are only eliciting a temporary change, and therefore it's about risk and reward. What's the risk of me smashing the patient to pieces to get this temporary change, this minimal reward out of it? So those are my three tips that I sort of talk about to students when I teach and how I treat. I want you to be ethical in what you do, clinically relevant in the techniques that you are using, and I want you to be gentle at all times. Boom.